This module is designed to provide an overview of drug diversion prevention methods for healthcare facilities. This module includes tips for developing a drug diversion prevention program. References have been included at the end, as this is not a comprehensive review of all drug diversion prevention practices. This is also not a substitution for medical or legal advice. Every institution should be advised by counsel in legal and regulatory matters.
Although drug diversion is difficult to completely prevent, it is important to recognize it quickly and address it once it has been identified. A program to address drug diversion should include 4 components: education, policies, implementation, and reporting. Education serves 3 purposes. It warns those intent on diverting, it cautions those who may be vulnerable to addiction and diversion, and it enables staff to recognize and report signs that may indicate a colleague is impaired or diverting. Do not underestimate the value of educating all staff, including housekeepers and maintenance workers. For example, maintenance workers may discover a stash of sharps containers or diverted drugs stored in ceiling tiles. All staff should be educated about diversion at the time of employment and regularly thereafter. Education about diversion should be part of every new employee orientation and should be reinforced continuously through annual mandatory training, leadership meetings, and specialty training programs. This helps create a culture where staff recognizes risk and feels responsible to report suspicions. In your facility's drug diversion educational program, it may be helpful to include examples of actual cases of diversion that have affected patient safety, prevalence of diversion, measures your facility uses to detect diversion, for example, reviewing every controlled substance transaction in the facility, proper drug handling procedures relating to withdrawal of drugs, documentation, and wasting, detailed lists of signs of diversion and impairment, and reporting mandates. Clinical staff should receive an additional training session devoted exclusively to the topic of drug diversion. They should be educated on recognizing and reporting signs of diversion and impairment. Often, the discovery, discipline, and reporting of a diverting staff member can be an emotionally charged matter. In order to avoid allowing emotions to control what decisions are made, diversion has to be handled with uniform procedures. The content of drug diversion policies is driven by patient safety and regulation. Policies must adhere to the requirements of the Joint Commission, CMS Conditions of Participation, the Controlled Substance Act, and federal, state, and local laws. Regulations require that records are kept to track drugs from receipt to end use or waste, and procedures be in place that protect against diversion, allow for rapid identification, and provide for reporting of diversion both internally and externally. Policies should cover drug security and handling, responsibility for surveillance, reasonable suspicion testing, and the actions taken when diversion is suspected or confirmed. Drug security and handling policies need to cover diversion risk areas relating to controlled substance receipt, storage, transport, and handling within the facility. Specific drug handling policies that your facility should address are keeping controlled substances secure in clinical areas. This includes rules regarding the timing and manner of wasting and rules against early withdrawal, application and wasting of fentanyl patches, documentation of medication administration and unusual medication events, dispensing at the time of discharge. Policies should also cover lower profile risk areas such as the management of patient medications brought from home, prescription pad security, and the handling of sharps containers. Specific surveillance policies that your facility should address are what surveillance data will be reviewed, by whom, and how often. This includes the statistical threshold on surveillance data, which will require further investigation. An investigation and handling discrepancies. This includes steps to take when suspicious transactions occur. Specific policies regarding reasonable suspicion that your facility should address are what qualifies as reasonable suspicion, including how anonymous reports and patient complaints will be handled, handling patterns of deteriorating performance, handling large groups, for example, significant discrepancies on a clinical unit, timing of and procedures for reasonable suspicion testing, consequences of a refusal to submit to drug testing, and handling positive quick test results, including whether those with positive results will be allowed to drive home. Specific policies regarding suspected diversion that your facility should address include internal notification requirements when diversion is suspected, such as to human resources, diversion team composition and function, time, manner, and personnel present for interviewing the suspected diverter, discontinuation of drug cabinet access, and recognition and management of employees who may be of harm to themselves or others. Specific policies regarding confirmed diversion that your facility should address include reporting, both internal and external, including who will be responsible for reporting, communication with the diverting employee's colleagues, scope of the investigation, for example, how far back in time will the investigation go, corrected billing and patient notification, referral to professional assistance programs, and what post-event reviews will be undertaken, such as critical event reviews. In addition to the specific drug diversion policies mentioned, having adequate human resource policies can help your facility avoid hiring potential diverters. Policies around investigating breaks in employment, completing thorough criminal background checks, obtaining appropriate references, conducting drug screens, and verifying professional license status can identify troublesome behavior that is characteristic of some diverters. Incorporating such policies in your facility's human resource protocol may decrease the likelihood that a diverter will be hired and may ultimately prevent drug diversion incidents from occurring.
Implementation of a diversion program should be in the hands of someone with clinical knowledge, a diversion specialist. Ideally, the diversion specialist will have a clinical background, knowledge of medications used within the facility, and the ability to conduct an effective investigation. They can be a member of risk management, pharmacy, nursing, employee health, or other appropriate department. The diversion specialist will take a lead role in prevention, surveillance, and diversion investigations and will ensure regulatory compliance. Some facilities use a multidisciplinary diversion team led by a diversion specialist, while other facilities use a diversion specialist who may work more independently and collaborates with others as appropriate. If the team approach is used, the diversion specialist will serve as the manager of the program and will delegate ongoing diversion prevention and detection efforts as appropriate. The diversion specialist or team will serve as a resource to staff, oversee education and policy development, and ensure that all diversion-related activities are documented. They must have full access to the surveillance data and the related medical records, the ability to act quickly to protect patients, and the authority to confront and suspend a suspected diverter. The diversion specialist or team should monitor trends within the facility so that risk areas can be addressed quickly. To ensure that policies and procedures are being followed, the diversion specialist or team should conduct diversion risk rounds quarterly. Additionally, they should report to facility administration at least annually. Reporting of drug diversion activity is an essential part of the response. However, a significant number of facilities do not report drug diversion. All drug diverters will escalate if allowed to continue diverting. Appropriate reporting ensures that proper interventions take place and protects patients against diverters. Facilities that fail to report become complicit in subsequent patient harm and risk harm to the diverter who is allowed to continue unchecked. Federal regulations, state laws, and professional boards mandate reporting. These include reports of theft to the Drug Enforcement Administration, or DEA, and the report of illegal or incompetent care to professional licensing boards. The Department of Licensing and Regulatory Affairs, or LARA, is responsible for disciplining individual professionals regulated by the Michigan Occupational Code and Public Health Code. The Public Health Code states that it is illegal for a health professional to be impaired. Impairment is defined as the inability of a health professional to practice his or her profession in a manner that conforms to the minimal standards of acceptable practice for the profession. This includes substance abuse and chemical dependence. LARA oversees the Health Professionals Recovery Program, which is designed to be a non-disciplinary approach to treating addictions among healthcare professionals. For more information on the Health Professional Recovery Program, call 1-800-453-3784 or visit www.hprp.org. It is important to develop a collaborative working relationship with local law enforcement so that diversion cases can be handled appropriately. Many law enforcement agencies will work with healthcare facilities to minimize the risk to the facility of reporting. Documentation can be worded in such a way as to reflect a theft, but not the fact that an employee stole medications from the facility. Furthermore, many law enforcement agencies will provide an incentive to the diverter to enter a recovery program. Many states have treatment in lieu of conviction programs that provide a strong incentive for an employee to go through rehabilitation. In summary, all staff should be educated about diversion, and clinical staff should be educated on recognizing and reporting signs of diversion and impairment. Policies should cover drug security and handling, responsibility for surveillance, reasonable suspicion testing, and the actions taken when diversion is suspected or confirmed. The diversion specialist or team should monitor trends within the facility so that risk areas can be addressed quickly. And reporting of drug diversion activity to federal, state, and local law enforcement, as well as professional licensing boards, is mandatory.
For more information in developing a drug diversion prevention program, visit the following websites or click on the links in the description box below. We'd like to thank the National Association of Drug Diversion Investigators for use of their materials to develop this webinar.